Hi everyone, it's Michelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things birth, pregnancy, and womb health related. So if you guys like the content, you love the channel, please be sure to subscribe. Today's topic is going to be discussing whether or not a induction is actually an emergency or if it's not medically necessary. So recently I asked a question on a different platform. And basically the question was, what was the reason your doctor suggested or did an induction? Basically, like, what was the reason? Why did they suggest it, or why did they actually go through with an induction? And did you consent to it? So why was your labor induced, and did you consent to this form of labor augmentation? So I'm just going to go through the comments and read off the answers, and then I'm going to give my insight on whether or not it was medically necessary or if it wasn't. Please keep in mind that all of the information on this channel is for educational purposes only. It is not medical advice. Please consult with a medical care provider if you need to, if you need a second opinion, if you need first, second, third opinions, all of that stuff. Please note that this is just what I'm reading off and my view of it. The first one is the young lady says, because I was 41 weeks and he suggested that I shouldn't go past that. I consented because honestly I didn't know any better and I was only 19 years old. So already, first of all, being 41 weeks pregnant is not a medical emergency. Does not mean that you need to be induced. It is no clear indication that you have to hurry up and have your baby. This is not a medical emergency. It is not a medical necessity. There was no reason for her to be induced. If there was no clear signs of distress of the baby, her vital signs is great, mom's vital signs are great, fluid is good, water amniotic fluid is good, bag is intact, there's really no real reason to do this, to induce this woman's labor. So if you are in that situation, please ask further. Is there a medical reason? Is there some type of emergency? Why do I have to get induced? What are we doing this for? The next one was, I was 42 weeks, very close to 43 weeks. I waited long as I could because that was my worst fear. I actually got a cook balloon to help me dilate, which worked. I consented, but still I felt robbed of having labor start on its own. I tried everything to be before I went in to be induced. I walked up hills for hours one night with babe, some strong contractions, but still nothing. Okay, so my insight for this person is that due dates are estimates. They are not exact. You could have very well been 41 weeks when they thought you were about to be 43 weeks. These are just estimates based off of measurements, based off of possibly knowing when your last period was and when you ovulated and all of the exacts that need to go into play. So if your baby's, again, vital signs were good, you are good, everything is fine, there's no signs of distress. There has been studies that said women have gone to 44 weeks and birthed a perfectly healthy baby. So I don't feel strong about this reason either. I don't feel like this was a medical necessity. It was no emergency here that I see. The next person says, they said my amniotic fluid was low. I was only induced for my first pregnancy. I naturally went into the labor the second time. So here, having your amniotic fluid be low is concerning. There is definitely some concern there. I feel like there are other ways to address this besides induction. Um, but if the baby was in distress and the baby was, the vital signs or the heart rate was, dipping, or mom was in some sort of, you know, pain, or there was an infection or something like that, then I would say that that could lean towards a medical emergency, but not if all of those things weren't present. There's definitely ways, bed rest, increasing water. They can also increase it for you while you're at the hospital. But there were definitely other options. She also then went on to say she did get a second opinion, which I'm very thankful for that. I'm proud that someone said, hey, I'm going to go see about this. I'm not going to just take the first person's word for it. So that's awesome. Um, the next person says, my water ruptured and they needed to induce me. Once they induced me, they realized my son was breached and heart rate dropped. So I had to do an emergency C-section. Um, so this uh, could necessarily be a medical emergency. Um, I don't know how far this person was when the water broke. And I don't know uh, the level of health of this person at the time. If your water breaks and you are a healthy individual, you definitely have at least 24 hours you can um, before you need to seek medical attention. As long as there's no fever present, as long as there's no signs that baby is in distress, or that blood, like excessive blood or anything like that, then you definitely have time to go into labor on your own. I'm not necessarily seeing an actual emergency just because I don't have all of the information. So I can't really respond to that one as much as I would want to, because I don't have the specifics. But the next one said my baby was over or underweight, but she was 7 pounds. I didn't do the induction. Thank you. You're awesome. I've talked about this in a different video. There is no way a doctor can be sure about how much your baby weighs. You can't stick a scale up there and sit the baby on it. These are all estimates. This is all looking through an ultrasound or feeling with the hands. It's really no possible way to know how much your baby weighs. So this is definitely not a reason to be induced. It is not a medical emergency. The next person said the baby heart dropped, and no, I did not consent to this. Okay, so baby heart dropping is concerning. It could lead to this being a medical emergency. I don't know for sure what happened in the specifics of the situation because her answer was very vague. But the fact that you didn't consent is an issue, because someone just doing an induction without your knowledge, or just doing it and not asking you and giving you all of the risk and benefits, and that's just a no. Like that's a lawsuit, and that's something that should never be done. That's obstetric assault. So yeah. So the next one is, since this was my second baby, labor should be progressing way faster than this. So this one, let me reread this. It says, since this was my second baby, labor should be progressing way faster than this. Okay. And then she replies again. It says it was Thanksgiving. Here's the thing about this. There is nothing in the book that says since you already had a baby, your second baby should come faster. Everybody's body is different. Every baby is different. Every pregnancy is different. Every labor is going to be different. It does not ever mean that you need to be induced simply because you had your baby in 5 hours the first time, and then this time it's 8 hours. Because first of all, nobody can say or know how long you labored at home, or any of the specifics. So this, first of all, is the number one thing. Secondly, it was Thanksgiving. This is something that really gets on my nerves because um, it is statistically shown, and you can look this up, that C-sections are higher. The rate of C-sections are higher during the holidays. This is really disgusting because this indicates to me that medical providers, doctors, OBGYNs, whatever, whoever, nurses, whatever, are all trying to rush to get home to their families during the holidays. So we're scheduling either C-sections or pushing inductions so that we can get a move on. This, to me, is completely um, disgusting. It's disgusting because it it causes harm to the lives of people that never have to happen. First of all, um, so keep this in mind. If you are due around the holidays, please do not give in to the pump fake of, oh, you need an induction, your labor is not progressing fast enough, we don't want you to get an infection, blah 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 blah. Please don't give in to that. Ask questions, be stern, um, learn how to see when they are monitoring and what it means, your vital signs. Please know this information because their verbiage can get real funny, and so I think that that's something important to know. um, the next one says, we were talking about my birth plan. I was 39 weeks and my midwife asked if I wanted to be induced. I was concerned because I thought it was only for emergencies, so I said no. You are amazing for saying no. You stood up for yourself. You used your logic. You used your instincts. I'm proud of that. That's awesome. Um, the next person is, I got induced at 39 weeks because of preeclampsia. So I can't, preeclampsia would be a reason, but depending on how severe, because preeclampsia can be mild and you can have your baby and you don't have to be induced. But preeclampsia can also be a little bit more severe and going into the stages of eclampsia. So I don't know the specifics of what was going on in this situation. What I do know is that you have preeclampsia, and you knew, and the doctor knew about this ahead of time, that there should have been something or measures taken, or them giving you suggestions on how to reverse this, how to um, strengthen the body and the organs, or how to um, regulate your blood pressure. It should never have been just, oh, you got preeclampsia, we're just going to monitor you. I see that so much. It's never preventative care, but it's care when you come in to have labor. I don't understand that. But the next one says, my blood pressure was 125 over 90, and they did not attempt to recheck it. She also goes on to say that the cuff was too small, and she definitely should have, asked for a redo, but she was young at the time and she didn't know. 25 over 90 is not um, super horrible. It's very borderline concerning. So I definitely do encourage, if you have a blood pressure in this range, that you ask for a redo, and that you ask for the other things to be checked, because this is not really like a huge, ooh, we gotta induce right now because her blood pressure is 125 over 90. Because sometimes 125 over 90 can mean I'm nervous, or it's a lot going on and my adrenaline is up, or I haven't I ate a large meal, and it's not always like, oh, there is an issue. So definitely something to look into when someone is telling you something about your blood pressure, because you definitely want to ask for another reading, and just get a second opinion, because sometimes it's really not, like, if your blood pressure cuff is too small or too big, especially on a machine where they are the automatic one, it's not going to read correctly. So you definitely need to have like the right size for your body type. um, and you need the right reading because that's important, because that's like a give or take, you know. So the next one says advanced maternal age with no issues or complications, because she was 42. No issues, no complications. I'm fine, baby fine, fluid fine, heart rate fine, blood pressure fine. But I'm 42, so that just means I have to have my baby at 39 weeks or whatever. No, this is not a medical emergency. This is not, this, no, this, no, no. Um, so the next one says 40 years old, I had a miscarriage. I got pregnant again. My pregnancy was very hard. I was 7 months pregnant when my blood pressure was sky high. I couldn't get it down. I was in a lot of pain. The baby might have been in distress. Went to the emergency room. They gave me things to try to get it down while they monitored the baby. But so I wouldn't go into premature labor. But after about 2 hours, my doctor opted for a C-section because baby was in distress and she did consent. So this is something. This is like the one where it's like a clear emergency. First of all, she is way early in the process to be having any sort of contractions. Baby should not be in distress. Baby heart rate should be dipping. Her blood pressure was extremely high. This is all signs and reasons for medical intervention. I had so the next one is I had preeclampsia at 37 weeks. My foot was super swollen like a balloon. I went in for a routine stress test and my blood pressure was up and down like crazy and was feeling a lot of pain and pressure. This may or may not be an emergency. I think that other things could have been approached beforehand. I'm not sure, you know, what caused the sudden preeclampsia, but and I'm not sure when she was induced. So this is something too that I kind of gotta get like the gist of before I can really dig into that. But it could go either way depending on the specifics of the situation. The next one was I was 40 weeks and 4 days. I was extremely uncomfortable. Coming to find out, my water sac had ruptured prematurely and I had a slow leak. So I know that slow leaks can be causes for concern, but I have seen situations where people have, you know, went on bed rest, increased their collagen, increased their water intake, you know, did certain things nutritional wise, and the sac has resealed itself. But also at this late in the game, I think that 40 weeks and 4 days, if labor hadn't started within the next 24 or so hours, and there was some sign of infection, and the baby was in some sort of distress, then I think that you would need some medical intervention and, you know, to move forward in induction. But also keep in mind that you don't always have to go straight to Pitocin. There are other forms of induction that does not always result right to medication. And I think the last one says my first one was because of seizures and my blood pressure was 165/90. Second one was because of blood pressure. I had preeclampsia, and my third one was because I had an infection that needed treatment immediately if my water broke, but the ambulance couldn't get down the road because it was so bad that she decided to induce me before my water broke at home, triggering the infection to reach the baby and possibly killing him. She specifically ordered antibiotics, and my lips swelled up, and she goes, "Not an allergic reaction. We can't stop. We need to finish. My last pregnancy was the worst for me." First of all, you give someone medication that causes an allergic reaction and says, "We can't discontinue this medication. We have to finish it." So no matter if it kills you, no matter if I go into anaphylactic shock, Uh, we're just gonna continue on with this medication because we have. Wow. Okay. So these a few of these reasons were definitely causes for some medical intervention. The infection, I'm not sure what the infection was, so I don't know if it was something that could have been just cleared up with some antibiotics. I also don't know if how far this woman was when she was diagnosed with this infection. So I don't know why they would be like, oh, we want to hurry up and induce you because we don't want your water to break now. She was like 42 weeks or 40 weeks, and it was like any day now you can have your baby. Then yeah, I could see that, but I also don't know what this infection was that could just get into the baby's sac and kill him right away. I don't know. I don't have the specifics on this, so I would need to know um, more about the situation to really dig into it. But the whole like antibiotic situation with the allergic reaction like that is just taking me out because I don't understand how someone can say like, oh well, we don't care about this, you know, possibly killing you. We just got to keep on. Sometimes, you know, I hear some crazy stories. So this one, like I said, so the seizures, the blood pressure, and things like that do cause for concern. Preeclampsia definitely could go either way. I don't know if it was severe, mild, or whatever the case may be. But yeah, so I just wanted to go through those things because I often hear a lot of people say I had to get induced because um, my doctor said there was something wrong. Most of the time, when the person tells me what was actually wrong, it's not a real reason. It's not a medical necessity. It's not something that's like, oh, we have to do this right now. Because if we don't, something is going to happen to you or your baby. So I just wanted to go over that, and I use that as just a way to show actual people real experiences and just to give my insight on it. So yeah, being older does not cause for it does not call for an induction. Uh, being 42 weeks or 41 weeks does not cause for an induction. Because your baby may or may not be underweight or overweight does not cause for an induction. Just because your water broke does not cause for an induction. Just because your baby's cord is wrapped around his or her neck does not call for an immediate induction. Because a lot of babies are born that way. It does not necessarily mean that the baby is struggling. So if the baby's heart rate is fine, if the baby is still growing well, if the baby is doing fine and you're doing fine, then it's not a real reason to do anything that would cause more issues unless there was an actual reason. So that's my take on it. I hope this was useful. I hope this was helpful. I love the fact that a lot of women knew that, you know, it was unnecessary and that they know more information now and that they will utilize it and implement that for the next time or for future, you know, friends and family. I think that's amazing. So if you guys would like to dig into the topic a little bit more, please reach out to me or, you know, drop the comments. If you would like me to talk about a topic that I have already discussed, please email me at birthuhura@gmail.com. And I'll see you guys for the next video. Again, thank you guys so much. I'm Michelle. I'm a doula at Birth Uhura. Peace and pregnancy does.